Hi, everyone. My name is Dr. Caroline Fari. I am a professor of human performance and sports studies at Idaho State University. I am super excited to be able to offer you this class in the care and prevention of athletic injuries. So I've been a practicing athletic trainer for about 27, 28 years now, and my focus was on high school athletes. So I know where you guys are sitting in the continuum there of injuries, how many kids you have. Some of you have athletic trainers, some of you do not, but irregardless, I guess, all of you have responsibilities with kids, keeping kids safe. And I just really applaud you for signing up for this class. One thing I want to get out of the way really quickly is that I'm not going to be teaching this class for medical providers. It's really going to be simplified in a way that hopefully will resonate with those of you who are in the coaching setting. I'm not going to get into really heavy anatomy, in other words, in this class. I'm not asking you to diagnose injuries along the way, but I am going to show you some of the most common injuries that occur in sport and some situations that maybe predispose kids to additional risk of injury, in hopes that maybe that will help you as a coach approach your sport setting, and at least be able to adhere to your legal responsibility to immediately recognize injuries when they occur, and then know when to refer out. So those are the primary goals of this class. And with that, we're going to get started. My first lesson for you is really dealing with what a sports medicine team consists of. So you as coaches have a definitive role within that sports medicine team. So what is sports medicine? First of all, we need to understand that it is not a single discipline. It is a very wide, expansive discipline that an umbrella term that is used to include a myriad or a large number of different healthcare and sport professionals, people who have the singular goal of keeping kids safe in athletic participation, and also maybe maximizing their athletic performance along the way. So lots and lots and lots of people. So like I said, sports medicine is an umbrella term. We see it in healthcare settings in particular, to basically cater to the physiological needs of those individuals who are physically active. So we may look at high-level athletes like professional or Olympic sport athletes, and it can range all the way down onto the youth sport levels, the 5 or 6-year-old that maybe is getting their first experience with a soccer game. So sports medicine is a philosophy of medicine. And when you see or work with sports medicine physicians, as I do, we really see this philosophy shine. Sports medicine physicians are people that are used to dealing with highly motivated athletes. So the mindset is a little bit different. So let's use an example of just a basic grade 1 ankle sprain. Somebody tweaks their ankle. If mom or dad takes that child or goes themselves to a typical doctor, that doctor will probably end up putting them on crutches, and telling them to stay off it for 3 or 4 weeks until it has a chance to heal. And that is absolutely an accurate approach to caring for that. Those physicians are looking at pain. Okay, so if we're managing pain, that is a very appropriate thing to do if it's not broken. A sports medicine physician, in comparison, may look at that grade 1 or that mild ankle sprain, and they may kind of rely on the psyche of the athlete and the motivational aspects of the athlete to want to get back into competition, and may, I guess, institute a rehabilitation plan that understands that athlete's going to have to tolerate a little bit of pain. So for example, me as an athletic trainer, if I get that athlete that has a grade 1 ankle sprain, I'm going to want them to walk on it pretty quickly. Maybe I'll let them cry about it for a day, but I really want them walking on it. Maybe the walk is very slow. Maybe it's heel to toe and springing off that toe, because I want to have movement in that foot, and I want to have fresh blood flow come to the area that brings those healing agents to heal that ligamentous injury. So along those lines, I'm not going to put the athlete back in until I know that they can do everything safely. I'm going to stress rehabilitative exercises, strengthening, and I'm also going to stress the importance of cryotherapy or icing the ankle to make sure that no swelling can accumulate in those areas. So that's the difference, managing pain or dealing with a little bit of pain with the ultimate goal of getting that athlete back to competition as safely and as quickly as possible. That, the latter, is really what a sports medicine approach or philosophy of medicine is all about. So two different realms of sports medicine that we talk about a lot. The one on the right there, the injury care and management, those are the ones that you are really familiar with, right? The athletic trainers or the physicians, the physical therapists, the massage therapists, those people who are there to help the athlete deal with injuries when they occur, or maybe work on the preventative side to prevent injuries from occurring in the first place. The performance enhancement part of the sports medicine team, those people are equally as important. They deal with, in many ways, preventing the injuries from occurring in the first place. So think of your strength and conditioning coaches working to get athletes bigger, faster, stronger. Think of the exercise physiologists that maybe work with understanding the performance aspects of blood lactate thresholds or VO2 max, what an athlete is capable of doing, and maybe we increase the amount of lung capacity that they have if they're a runner, so that they can go farther at a faster speed. The biomechanists who deal with just the action of the sports skill itself. Think of throwing a ball, and we want our elbow coming back and reaching back and releasing it just at the right time in the deceleration phase to get maximum velocity on the ball. But not just that, bringing the elbow in to minimize the pressure on the UCL or ulnar collateral ligament, so that these kids aren't suffering or are at a greater risk of suffering significant elbow strains. So those kind of things. Our nutritionists worrying about what kind of fuel we put in the body also, because that has a very direct correlation on the likelihood of injuries. And then, of course, the sports psychologists who deal with, anything ranging from that mental preparation of performance, getting ready for the game, but also on the injury side, how do we help athletes deal with or accept the injuries that they've incurred, so that there's not a subsequent loss of athlete identity or personal identity, so that they don't have social isolationism or they don't suffer from ongoing depression. So all of those things, all of these types of disciplines are just critical components of the sports medicine team. So at the high school level in particular, I know that I had to deal with parents on a regular basis. Obviously, the athletic trainer and the physician work together to recognize those injuries, diagnose those injuries, and develop treatment plans for those athletes to get them back on the field as quickly as possible. But we also have the parents that are in the mold. Parents often, how do I say this delicately? Sometimes parents aren't thinking about the injury as much as the athletic trainer and the physician, and sometimes they're not as concerned about the injury as maybe the coach is concerned. So sometimes we need to put the reins on those parents as well. And I think that the best approach to that is just giving them a lot of information about the injuries, about the risks inherent in the sport, and really how those decisions are made by the athletic trainer and the physician, and how the coach will proceed with that athlete if accommodations or modifications in the sport are necessary. And then obviously the athlete. I mean, educating the athlete is going to be really important. You're going to hear a lot and read a lot in this course about the importance of just informing the athlete about the risks inherent in the sport program, so that they fully understand. Even though it might be a 14-year-old or a 15-year-old, they still cognitively get it. They understand that injury is part of the game, but getting them to understand what to look for, or how serious that injury may be, or getting them to try to rationalize that, okay, if I play this Friday night, it could mean that I'm out 3 more weeks or 4 more weeks, or maybe the whole season if something happens again. I get that a lot with our concussion patients. So just having that educational aspect of teaching kids and teaching their parents about injuries is really important. And then you as a coach need to be aware of the injuries that are inherent in your sport. If you're a baseball coach or a softball coach, you need to understand about UCL injuries and shoulder injuries. You need to understand about collision injuries that could occur at home plate. So those types of things. And I'm sure many of you already do that, but hopefully this course will expose you to a few more along the way as well. Okay. So in the next lesson, in lesson 2, we're going to talk a whole lot about the athletic trainer. So I'm going to kind of skip through some of this, but about 40%, 45% of schools in the country, high schools, have access to an athletic trainer. And many of you, most of you know what these people do. They're highly qualified healthcare professionals who work in the sports setting. They are responsible for that day-to-day care of the student athlete. So that can be some preventative things. It can be that initial evaluation of the athlete. It can be designing rehabilitation plans. These folks are super educated in a whole bunch of different areas. And I may add that often the high school athletic trainers are the best athletic trainers out there because they're used to dealing with so many sports and so many different age levels. So props to the high school athletic trainers. When we talk about acute and chronic injuries, what that means is an acute injury is something that suddenly happens. So think about that basketball player that may be going for a breakaway layup and gets undercut and maybe sprains their knee, sprains the MCL of their knee. That would be an acute injury. It happens suddenly as a result of contact. A chronic injury, also called an overuse injury, happens over time. So think about those runners. I like to think in Idaho about our track and field programs. They get out there in March, and it's always still cold and snowy here in Idaho in March. And these kids are out there in cold environments. And after about 2 weeks, my training room was flooded with kids complaining of shin splints. This is not something that happened suddenly. It's something that happened progressively over the course of a couple of weeks. With kids running on uneven surfaces or what have you, just not being properly conditioned, or the weather not being good. It was cold outside, and these kids, this nagging shin pain or muscle pain progressively got worse. So that's what we talk about with chronic injuries. See those a lot in running sports. Athletic trainers work under the written direction of a physician. In just about every state in the country, athletic trainers have a directing physician that supervises their medical practice. So here in Idaho, we have directing physicians that sign off on our abilities as an athletic trainer. Obviously, we have national standards that we have to follow. But then once we pass all of those national board exams and license with our state, we still have to have a directing physician who helps guide us on what he or she may want us to do in the setting, what those protocols are, what we can do, what we can't do, when the physician wants to see the athlete, when the athletic trainer is comfortable taking the athlete from start to finish. So those types of things. And then also athletic trainers, probably the most critical thing that they do in the schools, in addition to those things, is that they have a broad network of medical professionals that they're connected with in their community, and they know how to get those referrals done in a timely manner. They know the injury that the athlete has sustained and who the best, most appropriate person is to take that athlete to the finish line, either through a more comprehensive, a thorough evaluation, to designing rehabilitation protocols for those athletes. So team physicians typically work in a volunteer capacity in our school settings, and that includes at the college level. At the high school level, it's almost always volunteer setting. And these people are responsible for directing the total health care of the athlete. So these folks, like I said, oversee or direct the athletic trainers in the school, if there are some. If not, then it's these physicians that do this solely. They're the ones that make the decisions about whether or not an athlete can continue to play. We see that a lot with our concussion legislation across the country. They typically work, as I said, in a volunteer capacity. Those are things that you want to make sure to work out with those physicians, and also with your school district, to make sure that the medical malpractice insurance is covered. Typically, if it's a contractual agreement between you and a physician that they're going to be there and cover your team, If somebody gets hurt, if they're up in the stands, they're going to come down, whatever, whether that's a written agreement or a verbal or just an understood agreement. It's always good to have those things in writing and to know that that there's some type of medical malpractice insurance that covers it if something goes wrong. And it does sometimes. It's very rare, but it does happen. And if those physicians are under that contractual agreement, typically Good Samaritan laws will not cover that. So with the team physician and the athletic trainer, it's very important that they have absolute authority on deciding whether or not an athlete can play. We always have this saying in sports medicine circles, when in doubt, sit them out. And that's something that I told my coaches constantly. If I wasn't there, if you're not sure that that athlete can resume competition safely or participation safely, if they're whining a whole lot, that they're not feeling right, or they just don't have strength, then you sit them out and you get that referral to a physician or wait for the athletic trainer to be able to see them. Always, in medicine, we always defer to a higher medical authority, and that is the physician in all cases. Other sports medicine team members that we see, I just want to point out that the role of the nurse and other school health services in this sports medicine team. Many of you don't have athletic trainers. You might have a school nurse. Here in Idaho, we don't have a lot of school nurses. But if you do, getting this person on board and being able to communicate with him or her, some of the injuries that are occurring to the kids can be really advantageous. I think about a kid maybe that blew his knee on a Friday night and is going to have crutches and is going to be really slow to get around school on Monday morning. Talking with the school nurse and letting the school nurse know that this injury occurred, and that this kid is going to maybe need to come in and get some ice periodically throughout the day, or even talking with the counselors and letting your school counselors know that this kid was injured and may need extra time to get to and from class. So those kind of things can be really helpful to include those people in your information flow. And I have to point out that information that you give them typically should be HIPAA compliant, which means HIPAA is like FERPA in the schools. It protects that medical information. So make sure that you're getting the okay from your athlete's parents to share that information. And the best way to do that is through the pre-participation physical exam, to have the parents sign off on you being able to give that information out. Just if you're administering a athletic healthcare program, a sports medicine program, lots of different things that you have to think about. I want to highlight a couple of these. First of all, hiring staff. Make sure that whoever you hire to do these roles is appropriately qualified. We're going to talk a lot about that in the next lecture and the next lesson on athletic trainers, but making sure that they have the proper credentials I cannot stress enough how important that is. If you have someone doing a job, a medical healthcare job, that is not appropriately qualified or credentialed, that can lead to an increased liability for your school. If maybe they misdiagnose something, or they don't give a child the appropriate care, and there's a lawsuit later, that's you and that's that school who's liable for that. So we want to make sure that we're hiring appropriately qualified staff. Also, the other one I want to point out to you is just record keeping. This is a very time-consuming part of the athletic trainer's day, is just keeping appropriate documentation of the athletes they see, of the injuries that they were complaining of, the signs and symptoms that they were exhibiting or complaining of, maybe what happened specifically to cause that injury, and then also specific instructions that were given to the athlete, whether it be to go see a physician or to go do these ankle exercises or these knee exercises or to ice, whatever it may be. So that documentation is going to be really important to help, I guess, CYA. The dealing with the NCAA part, I just wanted to point that out too, I guess. I realize that you guys aren't working in colleges or university settings, but some of these kids may have aspirations to play college sports down the line, whether it be the NCAA or NAIA, NJCAA, or another organization. If they sustain an injury during their senior year of high school, sometimes those injuries will carry over into their freshman year. So if that looks like it's going to happen, like an ACL tear, then you may have to provide good documentation and good information to those college athletic trainers and coaches, just in case that there's any application for a medical red shirt that freshman year. Providing coverage we'll talk about in a little bit too on the next lesson. Next thing I want to talk about are these pre-participation physical examinations, or PPEs. What you need to understand about these is that they are put in place, they're required for athletes not to tell how healthy they are. Instead, we're looking to see if an athlete has anything going on physiologically that could predispose them to additional risk inherent in the sport that they're hoping to play. So again, it's not saying how healthy we are. It's not saying, hey, they're great, they're on the 99th percentile. That's not what these tests do. They just look at basic screening to determine whether or not an athlete is healthy enough to play the sport. They can be disqualified or recommended to be disqualified from certain sports while being okay for other sports too. So it just depends on the condition. So different things that they'll look at. We do these tests in Idaho before the athletes are required to have them before their freshman year in high school, and then again before their junior year. The physicians that do these PPEs are getting a fairly comprehensive medical history. They're looking at just a basic physical examination, anything from height, weight, ear, eyes, nose, throat evaluation. They get into orthopedic screening, just basic orthopedic screening to see if the joints are working. Something as simple as a duck walk can be an examination used. Looking at basic neurological screening and basic cardiovascular screening. Ideally, your PPE will consist of an EKG. I think we all got the scare of a lifetime when we watched Damar Hamlin go down in the Buffalo Bills game at Cincinnati. But just testing these kids' hearts and making sure that they're ready for that. I know that we've had multiple athletes here at the school that I had worked at be disqualified because of cardiovascular things. And really, it wasn't a disqualification. It was more of a recommendation that they see a cardiologist for more screening to determine whether or not that issue that they got on the physical night, or that arrhythmia that they heard, was something to be concerned with. So don't be too alarmed if a physician says, no, I'm not going to sign off, I'm going to recommend that they see a specialist. That's always a good thing if we can intercept something that might be potentially fatal down the line. So the roles of coaches within the athletic healthcare team, first of all, understand your limitations as a coach. And I'm sure there's not any of you out there that want the full crux of this responsibility of taking care of kids and being that medical provider. Unfortunately, you inherit a lot of that job because you're with these kids. Often more than these kids are with their parents, they're with their coach. You have a unique relationship with these kids. You know what normal is for these kids. And you see the injury when it occurs at your sport practice or your game. So just understand the limits of your training and of your care. And again, when in doubt, sit them out. When in doubt, refer it to a higher medical authority. I could cite off a number of court cases where the coach was found liable for an athlete whose injury wasn't properly cared for in the first place, or a coach who did not refer an athlete with an injury to a medical authority. So don't be that guy or that gal. Make sure that you're understanding the limits and that you're applying what you know to be the best immediate treatment and care possible for that athlete. And unless you're absolutely sure, don't allow them to keep playing. Never assume too that, oh, I've seen this a million times, this is what it is. I can tell you that I know a lot about concussion. That's one of my areas of expertise, but no concussion is the same. No concussion presents the exact same way. So just know that injury can be very complex. None of us have X-ray vision. We can't see what's going on. So rely on a medical provider to tell you what's going on. Other things that the sports medicine professional is going to do, we're going to talk more about these in the next lesson, so I'll just skip that. On the pre-participation physical, these are some of the things that a physician might disqualify a kid from playing. The rule of twos, what that means is if you're supposed to have 2 lungs or 2 kidneys, then you need to have those in order to maybe play a contact sport. The rule of thought there is if a kid only has 1 kidney and he gets hit in the flank, and something happens to the other kidney, then we've got a life-changing situation on our hands. So just understand that those are the ways physicians typically make these disqualification decisions, or as the last bullet said, these recommendations that they not play. Athletic training rooms, if you're looking to set up an athletic training room, just understand you need a lot of space for these things. At my school here in little Idaho, we had about 400 student athletes coming through the athletic training room. And so that is a lot of kids that are coming through. When you count, in the fall sports season, we had 150 football players, we had 40 cheerleaders, we had, 60 soccer players that are boys, and another 60 that were girls, volleyball players, cross-country kids, etc. So just understand that there's going to have a high traffic flow. They need a lot of space. Also, if they can get a room with outdoor access, that the door goes straight to the outdoor playing surfaces, that is always helpful. Just so you don't have to navigate through hallways. That's especially difficult when you're trying to haul a kid with a sprained ankle. Try a big 280-pound offensive lineman. That's no fun to try to carry them and get them through that area. So outdoor access is always nice. Wide doors is also another thing. Think about kids that are going to be on crutches and be an extra wide load, being able to navigate, and also ambulance EMS personnel trying to get into the athletic training room and navigate through those hallways or into that room with their gurney. So wide doors are always really good. Emergency action plan, we'll talk about that in module 8. Okay, and then I always get questions, well, how much money does it cost? Some of you who have bought athletic tape alone know the answer to this. It's expensive. I think we've watched the price of athletic tape double in cost in the last 5 years alone. Post-COVID, it really tended to skyrocket in price. It tends to go with the flow of petroleum products. When the gas and oil prices increase, so does athletic tape costs, because it is a petroleum product with the adhesive on there. So anyway, my school, we had a program budget of anywhere from $5,000 to $7,000, and that had to get us through a year. We probably used between $4,000 and $5,000 every year just on athletic tape alone. That didn't even include all of the first aid supplies. A well-equipped athletic training room will also have lots of other equipment, higher priced items, things like stim machines, hydrocolators or moist heat pad, ice machines, whirlpools, game ready systems or cold compression devices. So those are the kind of things that are luxurious in sports medicine care. So that about sums it up for lesson 1. In lesson 2, we will continue on with looking at the role of athletic trainers on the sports medicine team, with the goal of helping you guys understand what those folks do. And we'll just put in a plug for athletic trainers. Thanks.